Welcome to Unnumbered. I'm your host, Dr. Amy, lifestyle medical doctor, speaker, and coach. I'm here to remind you that you are unique, rare, and one of a kind, and so is your health. So be prepared to be educated, inspired, and empowered to live a healthy and purposeful life. Okay, so today I'm super excited to welcome not only a colleague of mine, also a beautiful friend, Dr. Nic Giumarra. He is a distinguished medical professional with a specialization that sets him apart. Nic is not only fully trained as a vocationally registered Australian general practitioner, but is also a specialist in plant medicines and an authorized prescriber of medicinal cannabis. Not only that, he also is a leader in the fact that he works with the Cannabis Clinicians Australia team, and he also has a profound passion for integrative medicine. He particularly focuses on people with chronic pain, mental health, insomnia, autism, and autoimmune conditions. I am so excited because we are definitely on the same page, Nic, since we met each other probably almost a year and a half ago now, I think it is. Is it that long ago?
Yeah, it probably is. It's funny it always feels like longer. I've known people for about a year. I feel like people in this industry for 5 years, and it may have
Yes.
been 3 months. It's that sort of industry where we do have a lot to do with each other, and because of the nature of the work, it's probably a year or so, isn't it?
Yes. And I
Even
haven't
possibly
really
less. Anyway.
I haven't really gone into exactly how you got into this kind of plant medicine. So give my
Mm.
audience a bit of a background. So you're working as a GP, like tell me what happened, because
I
obviously this is a
yeah.
specialized area.
Yeah, this was very lucky actually. This was very serendipitous. I was traveling around Queensland in a caravan with my young family, and I accepted a locum position as a GP on Magnetic Island off Townsville. And so we're like, okay, well, let's live there. And this was in the middle of the pandemic, and we were the luckiest Victorians and had escaped to Melbourne totally at the perfect time at the start of it. And we were leaving in a caravan when Victoria was getting shut. We were literally the luckiest Victorians. And I was working as a regular GP on Magnetic Island, and I was struggling. My patients were just, and a lot of people just, they weren't getting better. They had mental health issues, chronic pain. They were out of balance. Their guts didn't work. They had skin rashes. They weren't sleeping, and I was getting really frustrated with Western medicine, and I was getting really, that feeling where you just feel let down. You've gone to medical school, you've trained, you've worked your ass off, you've got burnt out, and you're like, what am I doing? Like, and I remember one day I went into a local cafe here, and one of the waitresses asked me if I prescribed medicinal cannabis, and that was early 20, well, maybe late 2020, and I scoffed at it. And I said, "No way! Can you imagine me prescribing it, and how many patients I'd be so busy, I would, you know." And I remember going home that night thinking that was a strange attitude. Like I'm normally so much more open-minded, and my dad's a GP. Actually, both my parents were GPs, funnily enough, and my dad had started prescribing before me. And I remember going home and looking it up that night, and literally, and I started doing some of these modules that some of the companies put out there because that's all that was available back then. And I think I sat there for 4 or 5 hours doing modules at night, and I was like, "Oh my God, this sounds amazing." And I started literally the next day. I remember my first patient was probably a 65-year-old woman on Panadol, anti-inflammatories, Lyrica, Nexium, the full common 10 type drugs. And I was like, "Do these work?" And she's like, "No." It's like, "You want to try cannabis oil?" And she's like, "Sure." And she was literally my first patient. And I fumbled through the application process and saw her a few weeks later, and she's like, "Yeah, my pain's better. I'm sleeping better. My rash is gone. My guts are better. My headaches are gone." And I was like, "Okay, that's interesting." And then had a second patient, and she got better, and a third, and she brought her husband with arthritis and epilepsy, and he got better. And literally 3 years later, 700 patients later, I've just haven't stopped. It just is a
Wow.
great medicine that works for most people. It doesn't solve everything, but it seems to work for most people, and they reduce their particularly opioids and benzodiazepines. And as you know, people just feel so much better off those medications. And I just haven't stopped really. So it happened really. A comment in a cafe started my journey on this. So and I still
Yeah.
see that girl sometimes. She still works here on the island, and I say, you have no idea you have no idea what that comment, what happened. Um,
Yeah, wow.
yeah,
And also dads always know best, right? You know, some people say mom, but it sounds like your dad knew best at this time. So taking a
yeah,
leaf out of his book too.
yeah. Mum had retired by that stage, so I was yeah, now he refers some patients to me because it's as the cannabis world has got so much more complex, and so many companies and products and technology, and it's hard to keep. For regular GPs, it's very hard to keep up with it. But
I
yes, it
completely
is.
agree.
Mm,
Let's talk about that because you know, we work alongside each other frequently and ask each other questions and things, and we've both been exposed a lot to
mm,
GPs that haven't yet had the time or had the person in the cafe, you know, approach them, and haven't had the time after a busy day to sit there and do the
mm,
modules. They haven't
mm,
yet taken
mm,
that step. And I know that I frequently get patients that say they've asked their GP, but the GP doesn't know how to prescribe it because they haven't been trained in it.
mm.
Tell me a bit about, you know, the problems that we face as GPs. You know, it's a busy schedule, and unfortunately, as you said, the product list is huge. You know, we've got probably over
Yeah,
500 products. Like, where,
Steph.
you know, if
Yeah,
what are they meant to do, and what are patients meant to
yeah.
do, or
I don't.
GPs
I've
meant to do?
Yeah, it's overwhelming. There's actually on the there's a website that lists them all, and there are 750 products at the moment. A lot of them are very similar, if not the same. I think you could cut it down to 20 or 30, and we would probably have enough. Um, yeah, look, I don't know. It's in a sense, cannabis medicine is very simple, but it's not easy. I mean, first you've got to do the TGA process where you've got to apply for approval, which is really just an online form, which but is time consuming. Then there's, do you start with a CBD only oil, CBD dominant oil? Do you add a little bit of THC? Do you do it in oil or tablet, or do you inhale it? And then, then there's the overwhelming world of all the actual dried flower products where people literally get, as you know, like a nugget of flower, like a dried herb, cannabis flower. And then what temperatures do you vaporize it at? And what percentage is it? What are the genetics of the plant? What's what we call the chemovar of the plant? What are the other ingredients? Because cannabis is a complex plant. I tell patients there's over 500 ingredients in it. I've heard a talk where people are talking about 1,000 ingredients in it now. And um, when people think about marijuana, they're really thinking about THC, which is just one ingredient. Um, I think it's overwhelming. I mean, it's overwhelming for GPs, and they almost best to, if you have a particular company, most companies have a nice range of products, oils, and a couple of flowers. You could almost stick to that and you would probably be fine. You don't, the
Mm,
problem is, and I think where probably doctors like you and I, where we're sort of, live and breathe this stuff, you get, this oil is probably better suited to your condition, and maybe we'll add this product, and you can pick and choose and find them. Um,
mm,
I've spoken to GPs and they just go, "Oh, look, it's too hard." And then with some of the other issues going on in the industry, they feel that doctors are scared. They don't know, is the TGA going to crack down on them, because there's a lot of rogue behavior in the industry as well that's commercially driven. Um,
mm,
and our colleagues would say, there's no evidence for it, which is not true. There's thousands of papers showing its benefit.
mm,
So doctors are worried about getting in trouble and time poor. Look, I think it's really tricky for your standard GP, which is why doctors like us exist, which ultimately we're probably not needed. Hopefully one day it just becomes a regular medicine in the toolkit and you don't need specialist doctors. But I think in
mm.
this phase of medicine, in this phase of us working out how to do it, and I think it's necessary. But and you would know this more than anyone, to use this medicine, you need a different paradigm, don't you? You need a different
Definitely.
approach to it, a different mentality, a different understanding to plant medicines. It's not just take it and that's it. There's a lot more to it than that, isn't there?
Yes.
When talking about intentions and goals and Yeah.
Mm. And I think
Mm,
you, as you said, I think it's really sad that the landscape of it right now is that more people are wanting it. So there's a lot of power, there's a lot
mm,
of movement in the people. A lot of people refer patients, right? So one person has a great experience and then they refer their family often to us. It's very quick in its movement from
mm,
people to people through
mm,
discussion.
mm,
But I had a patient the other day who asked her GP, and the GP said, "Sure, I can get you some cannabis." And she immediately said, and she just must have fell into it. She said, "Can I ask you how many people have you prescribed cannabis for?" And the doctor said, "Oh, 10 people." And she was like, "Oh, okay." And so she said, "You know what? I'm actually going to go and find someone that does
mm,
this, full time." And I said to her, "I see more than that. I can see 20 patients in a day." So,
mm,
and that's for the
mm,
last 2 years.
mm,
So I said to her,
mm,
if you're going to go and get any type of, if you go have a problem with your lung or your heart, you always get referred generally to a
mm.
specialist. So I think that it's a very difficult thing to try and ask our fellow colleagues to do
Yeah,
something
yeah,
that at the moment is quite specialized.
yeah,
And
it
you
is.
touched on the really beautiful point about it's not just as simple as giving the medication. It's that we also are very holistic, and I think that there's a huge amount of stigma to do with cannabis, and
Mm,
if the GP themselves hasn't heard or hasn't had their own personal experience with plant medicines and hasn't listened to what can occur, good and bad, then they are really scared. I mean, what kind of things do patients come to you worried about? Like, what are the common questions that they ask you that they're worried about?
I think probably the most common is about driving laws, which, as you know, are really complex. And well, essentially, you're not allowed to drive with THC in your system. And the question is, what does your system mean? Because the police are only testing for saliva, but it's in your system. It's stored in your fat cells, leaked in your blood and urine for weeks, I should say weeks afterwards, after finishing using it, but they're only testing your saliva. Then there's a question about, are you impaired when driving? And I mean, studies do show that people who use THC are impaired for about 4 hours afterwards. And so, I mean, like any medication, whether it's Lyrica or Panadeine Forte, if you're impaired, it's illegal. So that's a common one. People are unsure whether it's addictive or not, and it probably is. It's addictive in the sense that coffee can be addictive and exercise can be addictive, and people feel better on it, and so they do get addicted. I think people can have a withdrawal from it if they suddenly stop, but I don't think the withdrawal's as bad as coffee. Coffee withdrawals probably worse, and withdrawal from benzodiazepines or opioids far worse. So it's not a benign drug, and people worry if they're going to become sort of too impaired on it, and this is where the consultations I find take a long, like my initial consults are about 45 minutes, and it's explaining that somebody might have zero point 0.1 of a mil of a balanced oil with CBD and THC, and that might be all they need to fall asleep. Other people might need a full mil. So there's no set dose for people. And also, as you find, I tell everybody the endocannabinoid system is all about balance and homeostasis. And our lives are out of balance, our immune systems are out of balance, our gut is out of balance, our lives are out of balance. And it is trying to bring you into balance. So when people start, they might need half a mil, but in a few months' time, that half a mil is too much, and they need to actually decrease their dose. And sometimes it becomes a medicine you can put in the fridge or in the shelf and use it as needed. It becomes more like a cough medicine or something rather than a daily. Do you find that as well? Less is
Mm.
more.
I find,
Mm,
yeah, I mean, as we all know, the saying in the industry is start low, go slow, right? And
mm,
I had patients this morning, and the lady said to me, so what's the standard dose? And I said, I wish I could tell you. I wish I could tell you a standard dose, but I can only go from observationally of talking to thousands of patients that given your her past history has been using cannabis since she was 13 for anxiety. And I said to her, all I can do is prescribe something that I think is going to give you a similar beneficial effect. I'm not going to start you on something that's too low, because often we get those patients, right, that come to us and they have been using it for what we would say personal use. So they have had a medical problem, but they just have decided that the plant is the medicine for them, and have done it illegally. And now that they can get a prescription, they're very honest about it. And so their concern is like, hey, what's a normal dose? Am I too much? Am I too low? Should I be taking less? And the thing is that there is no, as soon as I say there's an answer,
no, exactly.
there's no answer. It's pure. And I think this is one of the beautiful things that I love about all plant medicines, is that it really starts to put the patient in the driver's seat. It allows them the ownership of titrating their medicine carefully and being fully honest, fully transparent. Like, patients often say, oh, I feel really bad, but I need to tell you I've been doing bongs. I've been doing X, Y, and Z. And I'm just not shocked by anything. And I think, as good clinicians, we need to be able to, see their side of things. And I think you're very good at that, Nic. I've had some difficult patients in the past, which I've spoken to you about, people with addictions and people with previous schizophrenia, and you've helped me with them. And, you've previously worked with people with addictions, right? Tell us a bit more about that, and where you see cannabis and other plant medicines helping them.
Yeah. Firstly, can I just make sure my kids are being really noisy in the next room? Can you hear them on the line?
No, I can't. Okay,
good.
It's great.
Oh, great. Yeah. I was a youth worker before. I did neuroscience at university, the behavioral neuroscience and honors in neuroscience. And then I became a youth worker, and I was working in Melbourne in drug and alcohol detox. And then I went into medicine and did GP, and I've sort of come full circle, really. So plant medicine, it's a big question. And you'll get this. This is particularly talking about THC. I had a beautiful example yesterday. I had a patient who was 65, 70, and she had long-term anxiety, poor sleep, depression. And I was talking to her, and you could just see the emotional burden she was carrying, and the self-blame and the lack of self-forgiveness. And I was like, why can't you sleep? And we were just talking, and it came out that she hadn't forgiven herself for putting her elderly father in a nursing home many years ago. And she was just carrying all this guilt and shame and beating herself up. And she was stuck. Her how patients have this, and we all do it, I guess. You have this narrative. You're telling your own story, and at some point you realize you're the baddie in the story, and that story just loops around. And people, they really they're the person beating themselves up the most. And that's where addictions can develop, because people need alcohol or illegal cannabis to sort of self-medicate, or other medications, or extreme exercise, online shopping. There's all these different addictions. People are trying to calm those feelings. What I've noticed, and you probably have too, is that little bit of THC, and sometimes it's in a balanced oil, 1 or 2 milligrams at night. What I think it does is it loosens up your neurons. This is about brain plasticity. You can almost feel it happening, that it changes. It's like there's a knot in your brain that you're stuck, and it loosens those thoughts and the story. And it helps people, I swear, it helps people tap into subconscious emotions, memories that they've forgotten, emotions they've repressed. And this stuff starts to come out, and people transform their story, retell the story differently with new information. Sometimes that can be quite distressing. Right. So I was listening to a psychiatrist on a webinar the other night, and they basically presented saying cannabis doesn't work for PTSD. And I was listening to this and looking at the research, and I was thinking, and this is the paradigm shift. Yeah, if you give a patient cannabis, it starts to release these emotions, which is uncomfortable for people. And I know I've been there as well. It's very uncomfortable. And you can feel it move in your body. Have you had people say, I suddenly get leg pain, or my leg twitches, or my arm twitches, or it's like this, the emotion that's stuck in your body is coming out, and that's unpleasant. And so if you took a study, if you were doing a study and said to a patient, is this helping your distress? They'll go, no, it's making it worse. Oh, therefore cannabis doesn't work. but it's not. It's the plant. The plant is trying to make you whole again, right? The problem is there are all these barriers you need to get through to become whole, and that is uncomfortable. So this lady was having, and I see this in lots of different ways, and I'm sure you do too, nightmares or memories, or you wake up in the night. And some people, have you ever had people who have had like a dark night of the soul, and then the next day they kind of go, right, I figured it out. I see my life differently. Have you had that? And they have like a horrible
Yeah.
night, but it wake up in the morning and they're like, oh my God. And I think it's this low dose THC. You don't need much THC, right? If you have too much, too high dose flower, too much flower, it doesn't quite work. It's this subtle, gentle, low dose shifting. And she started to forgive herself, and she started to like shift, and she's starting to laugh, and she's starting to feel a bit more joy in life. And you can just see that baggage letting go, and it's released from the body. And it's helped by, and this is where the holistic medicine comes in. Helps with exercise or gentle walking, or going into the bush, or some people swim in the ocean, or they start journaling, or they play music, or they start painting. You need to, or doing yoga. Yoga is fantastic for getting these emotions moving, right? Like particularly yin yoga. I think there's a lot of research in yin yoga. So you combine cannabis with all these other aspects of your life and give it 2 or 3 months, and it just starts to shift things, doesn't it? And it's the plastic, it's almost, I think it's a neuroplasticity. I have no absolute evidence that works, that that's what's happening. I just see it in so many people. And how do you explain that as a GP in a 5-minute consult to a patient with PTSD? You can't, can you?
No,
What do you
I
think
mean they've had it for
yeah.
years. Yeah,
Mm.
they've had it for
What do you think?
years.
What do you think's happening? Mm.
Well, I completely agree, and I absolutely love the analogy that you've got. I'm going to steal that if you don't mind, to
Oh,
some of my
okay, go for it.
patients.
Yeah.
I think
Mm.
anyone would be lucky to have you as a Dr. Nic. I think you're incredible. I think that I completely agree, and for me, I noticed that patients have this kind of just relaxation of their body. So a lot of
Mm.
people are walking around like zombies. They don't actually listen somatically, so they don't actually know
Mm.
much about their body. And then
Mm.
one day
Mm.
suddenly they get pain, for example, chronic pain.
Mm. Mm.
And then they're like, oh, I've like got a really bad back. And then they're like, actually, I've had a bad back for about 3 months, but now it's really bad.
Mm.
And
Mm.
for me, I find out of all of the plant medicines, because I'm across all psychedelic
Mm.
medicines,
Mm. Mm.
I find that particularly cannabis is very good at putting people into their physical body, into the
Yep.
present. And so people start to, whether that's just through the stress and anxiety, they just feel this relaxation. I
Mm.
often say to patients, you feel like you've just come out. When I find that people that are sensitive to CBD, so they've never had cannabis before, but they've got a bit of anxiety or a bit of depression or a bit of PTSD, I find that they get this feeling like they've just come out of a massage, like their
Mm.
shoulders relax.
Mm.
They just say, oh, just life seems to
Mm.
flow. And I didn't get
Mm.
as uptight as the kids were getting really annoying.
Mm.
And they
Mm.
just they
Mm.
just relax. And
Yeah.
there's
Yeah.
no way to describe it other than when the patient comes back to you and you ask them. But commonly, just like what you've described, people just feel this body like feeling,
Yeah.
and they get a feeling of being present. And if that
Yeah.
then allows
Yeah.
them to self-reflect and look on who they are as an individual, look at their shadow, look at things that they've done in their
Mm.
past, as you said, it can be uncomfortable, but it's almost like there's a resilience, there's a tolerance of which they can accept or start to I don't know, just give themselves self-love, give themselves like
Yeah.
the ability to find peace in things
Yeah.
that have been so horrendous in people's lives. And for
Mm.
me, that's just stunning. Like it's
Yeah.
so
Yeah.
beautiful. And like, I mean, we're such a privileged position
We're
to
so
hear
lucky.
people
I
have
know. I know.
these
And that's what,
stories. Hey,
talk to any, you talk to any cannabinoid physician and they go, finally, I feel like I'm doing medicine. I'm actually helping people, because I never really felt that way in GP. Like people would like me and they'd come in to visit and we'd have a chat and we'd have good relationships. But I'd go, am I helping you? I don't even feel like I'm helping you. But one thing I found, there's a great book, you probably know it, The Body Keeps the Score, by Bessel van der Kolk, and he talks about storing emotions in your body. And I love that when people, yeah, you're right, people tap into their body and they feel things, and stuff. People go, I started crying, and I don't even know why I'm crying. And I don't know. I wonder. It's like, is this the released emotion of a fight you had with your mother or father 30 years ago, but you were a child and you can't express it, because if you express it, it's like fight and flight, right? You can't fight your parents because that doesn't work. You can't flee because you're 10 years old, and where are you going to flee to? So you just have to suppress it. Is that the tears that you didn't cry 30 years ago? And people feel better. And then you say to them, is your pain gone? And they go, well, the pain's still there, but it doesn't really bother me, or it's gone to the back of my head. Do you hear people say, oh, it's gone to the back of my mind? And then I
All the
think,
time.
and then you hear the pain college going, oh no, look, you do a study on your pain, your back pain level. Is your pain better? And you score it out of 10. And I mean, personally, I find that people do get better. And studies do show that. But what happens is people are happier, they're sleeping better, their relationships are better, their pain goes from a 7 down to a 3. It doesn't solve it. People's problem is not cannabis deficiency. Maybe it is if you've got fibromyalgia, migraines, irritable bowel syndrome, these pain, these sensitive pain conditions where your body is feeling pain when it shouldn't really feel pain. I think, there's some evidence in America, there's the doctors there that say we shouldn't call it fibromyalgia, we should call it endocannabinoid deficiency. But for the majority of us, our lives are out of balance. We're holding on to emotions, and the pain is this mix of physical, emotional. It's this dis-ease of just being alive as a human being, right? And cannabis just, people need time to process it, don't they? And they need that resilience, as you say, when stuff comes up, to sit with it. And sometimes, I don't know, I think sometimes stuff comes up and it's not even your stuff, it's this intergenerational stuff. No, I
Yes,
say to
I
patients,
completely.
my other analogy, it's like you're clearing out your house, and you go into one room and you clear the black garbage bags and you throw that away and you feel a bit lighter, and you feel like you've done all the work and you've cleared it out. And then one day you open up a cupboard drawer and, there's another bloody bag of rubbish in there, and you open it up and you're like, this isn't even my rubbish. Whose rubbish is this? I don't know. It's my grandparents. Is it intergenerational? And
Mm,
and people sometimes say that with the psychedelic medicine, don't they? Like, I don't even know what I'm carrying, but I'm just carrying it. It's like,
mhm,
it's not your fault that you're carrying, but your opportunity to release it. And sometimes people say that all the time, don't they? Like, I don't even know why I'm crying. I'm just crying. Great, cry.
mm,
That's and
mm,
that's I it's 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 Western medicine would go, oh, you're taking a bit of cannabis, you had a distressing night, therefore it doesn't work, we better stop it. No, this is, and so if you tell your patients that, and I tell them all the time, you might experience this. I hope you do. And if you do, we can talk about it, or have a psychologist, or it's the exercise, diet, how important is creativity and play in humans and relationships. And you do all that. It's an active medicine. It's a tool, cannabis, isn't it?
mm,
It's not cannabis. We don't have cannabis deficiency. It's a tool to rebalance your life. And then when you're balanced, people often don't need it, do they? They say, actually, I
mm,
don't really need this stuff
mm.
anymore. Um,
And you mentioned before about like there's so
mm,
many different preparations. Like often we'll see patients, right, that might have used, let's say, the lady that I saw this morning, she's used cannabis since she was 13 for anxiety,
mm,
recreationally or personally, whatever you want to call it.
mm,
And I
mm,
spoke to her and I said, hey, like, how do you feel about using an oil, like rather than using like the
mm,
vaping? Because she prefers
mm,
to
mm,
smoke. And she was
mm.
like, I'd love that. Like
Yeah,
actually don't really want to smoke, and I
yeah,
understand that it's
yeah.
not good for me, and I just love that people in this kind of field are able to just be so open and honest and look at ways in which they can
Mm,
gently, not immediately overnight, just stop their cannabis use,
no,
but go to something that might be safer for them and maybe
yeah,
not affect their lungs. And I know
yeah,
a big
yeah.
thing that's often discussed is vaping versus smoking. Do you get lots of patients really confused about the whole vaping? Because I just feel like that's like half of my clinic.
Yeah, I do. It's always hard when you've got long-term illegal, for lack of a better word, cannabis users who have used for 30 years and smoked or inhaled as joints or bongs, because you're giving with oils and vaping, it's a very different experience. But I love when you win them over. Um, and I mean, with vaping, I tell people that this is my spiel. I say, first of all, it's they say about 95% safer for your lungs. Secondly, if you get a good quality flower and a good vaporizer, you can control the temperature and you'll get different effects and different personality out of the plant. It could be relaxing and it could be stimulating in the daytime, it could be relaxing in the afternoon, and it could be more of a sedative at night, depending on the temperature. And that's by the different combustion of terpenes. And so if someone puts cannabis in a joint, you light it up, it's about 300 degrees Celsius. It burns out 499 of the ingredients, and you're just getting pure THC at a high dose that goes to your cannabis 1 receptors in your brain and just does that. It's very one-dimensional. And so people get a certain experience quickly, and I think they get addicted to the process, the ritual, the rush, and the rapid onset of relief and that sort of stoned feeling, as we say. If you get a quality flower with 2 or 3% terpenes and you do it at 160 degrees in a vaporizer, it can be calming, it can be stimulating, it can be creative. A lot of my patients are actually, the average patient I once calculated was like a 41-year-old working dad who's at his desk, has back pain, or he's a weekend warrior, he's having trouble focusing. And so sometimes a tiny bit of flower can help their pain, their mood. And they go, I work well really day. I get home, I feel good. I'm better with my kids. I'm better with my family. I'm able to help out in the evening where they've normally just crashed on the couch. And also with the vapor, firstly, it's legal. Like if we prescribe a flower, legally people are supposed to use a vaporizer. If you get a medicinal cannabis flower, roll it in a joint and go to a public place, it's illegal. And so people should use a vaporizer. And often once they get the hang of it, they really enjoy it. And you end up using much less. So it becomes incredibly cheaper. So yeah, getting a good vaporizer is, and again, there's another conversation. This is why it takes 45 minutes. So how these clinics, there are clinics out there owned by the growers of the cannabis that run 5-10-minute consultations, charging patients $30, and the doctors only prescribe that company's poor quality cannabis to pharmacies they own. This is the heart of the problem of this sort of rogue, commercially driven industry. And these people they're not understanding how the plant is, and it makes it derogatory. It's insulting to the plant. And the TGA or the medical board will come in and go, this is crazy. They're writing these people, clinics are just pumping out the scripts, and these companies are making huge profits. It's short-term greed. I mean, how many times do you get patients from these clinics going, I've been on cannabis for a year and I have no idea what I'm doing. And they come to you for a proper consultation, and then you give them less product, less money, more oils, and it helps them. It dramatically changes their life, their family's life, their workplace's life. I mean, it's literally revolutionary, and I don't say those words lightly. So for me to see these companies and the rogue behavior in the industry is just a disaster. If this gets all shut down, what a setback for medicine, not only in this country, but also, I mean, I've consulted with patients in Canada and America where it's legal and people can go to their boutique shops and buy it. Let me tell you, the Canadians and Americans have no idea what they're doing. They're using the wrong doses, the wrong formulas, the wrong chemical things. They have no idea what they're doing. And doctors aren't prescribing it because they don't need to, because you can buy it from every second store. It's a disaster over there. Australians can be leading the world in this. And we are shooting ourselves in the foot because of these companies that are just pumping out scripts from flower grown who knows where, that's picked a year ago, that's dead plant, sitting in a dock in a shipping container for 6 months, run through a facility to get a GMP stamp, branded as some crap, sold for $80 for 10 grams, promoted on Reddit. It's a disaster. It's disgusting compared to how
I
good it.
completely agree.
So
We
my
were
little
just at a
rant.
conference. No, I mean, we were just at a conference together, and I think we spoke a lot about the problems in the industry, and I think you've hit the nail on the head. I mean, I would spread it further that it's not just the companies. I think it's also that we just have never ever seen medicine and kind of tech angel investors hit the pharmaceutical industry like they have before.
And add the recreational market and a medicine that people want to take.
Exactly. And so, just working in the industry, it's a whole different landscape. And, I think if we talk about the problems in the industry, the moral compass of some of my colleagues, I think it is yeah, a little bit there's a lot to say about it, and I'm not here to talk too much about it because I'm not super interested in it, because I just stay in my own lane. But I
That's
think
right.
the
Yeah, that's a good
reality
place to be.
is that we have an oath, we do no harm, and we're not meant to be biased in the way that we prescribe. We should be autonomous in what we prescribe. We should not be dictated by non-health professionals what we prescribe. And again, that was a patient yesterday, came from a clinic that, again, I won't mention, but came from a clinic that only the doctors only prescribe those particular medicines. And they were inappropriate medicines. And I don't actually know the catalogue of medicines that they have, but it was inappropriate. And I said, do you know anything about any other medicines? And she was like, no, because it's just purely, I didn't realize it's only their products. And the thing is that's a problem. So if you're listening to this and you're thinking, okay, I'm quite interested in looking at cannabis for whatever it may be, one of your health problems that you've been diagnosed and you have failed conventional therapy, or you're not interested in using conventional therapy, then my advice would be look for companies or clinicians that do have a moral compass, that are autonomous, and you can write to the companies and you can ask, how many people has Dr. Amy or Dr. Nic prescribed to? How many patients have they prescribed to? Are they autonomous in their prescribing? And I think this is about patients and the audience doing their own due diligence and actually knowing that they are going to the appropriate prescriber, because so many times they get it wrong because they think of finances. It's cheaper. I'll go to the cheap company. But yeah, I mean, you're obviously working. You have a leadership position, working with. It's the Cannabis Clinicians Australia, right?
Yes. So there's two main bodies, really.
Tell us what they do.
So the Cannabis Clinicians Australia there's three groups under the AMCA, the Australian Medical Cannabis Association, which was, I believe, the original cannabis body, and that was set up by Lucy Haslam, who's really the mother of this industry, whose tireless work now for about a decade. We wouldn't have a cannabis industry if it wasn't for Lucy. Are you familiar with Lucy's story? I wonder if your listeners are.
Yes,
it's an amazing. It's an incredible story where Lucy is a nurse, and unfortunately her 20-year-old son, Dan, was diagnosed and ultimately passed away from bowel cancer in his 20s. And his father, Lou, was the chief of the drug enforcement squad with the Australian Federal Police. And the only treatment that worked for their son was illegal cannabis. So what a situation there for pain, appetite, so they were giving their son cannabis. And I mean, they're beautiful. I mean, Lou and Lucy are incredible. And then the other person who was really involved in this is Helen Kapelos, who was the Melbourne-based journalist originally, who created a documentary about this story and other patients who were suffering and using illegal cannabis. And really, that was 2015 or so, and that got it all off the ground. And so now we call it Dan's Law. And Lucy set up AMCA. Lucy is still working day and night. I still get emails at midnight. You could write Lucy an email at midnight. She'll respond at 12:05. She's incredible. And so they set up AMCA, and now there's a doctors or clinicians group, there's a nurses group, and a pharmacy group. And so we all talk to each other as well. And then there's the ANZCCP, which is another subgroup, the Australian New Zealand College of Cannabinoid Practitioners. And the great thing at the moment is we're talking. There's sort of two groups, and we're forming an alliance. Right, let's crack down on this. Let's internally regulate. Let's teach people how to do this. Let's try to stamp out this behavior. So that's what we're really working at. But what I'd say for patients, and I shouldn't really plug anything, I think there's a fantastic website called Honallee, Honallee, which is an independent website that lists all the practices, and they now will say, there's little warnings, this clinic prescribes to its own pharmacy, this clinic, and it will list all the conflict of interests. And I think that's a really good way of starting point, because if you go to any of these websites, they all look the same. We're patient focused. Our products are the best. They all look the same. You have no idea what you're getting. So I would recommend people go to Honallee as a starting point.
I'm not
but it's
sure
a
if I'm even on
minefield.
Honolulu, but I know the team well.
Yeah,
But
they're good.
I
They're good
agree.
people, and they're trying to do the right thing for the industry. And I think there's a lot of good people in this industry really worried about what's going to happen and whether we've swung too far and it's all just going to get shut down. That's my
I
concern.
mean,
That's what keeps me up at night.
we talk about that. I mean, it'd be very hard to just shut it down because the reality is this. I mean, I can't remember the exact statistics,
They
but
could. Mm,
each 6 months, the amount of prescribers
mm,
and people with
yeah.
medical prescriptions is
Mm,
going exponentially high on the bell curve. Like
mm.
we're in the innovative stage of it. So I just don't see
That's
it slowing
no.
down.
It's yeah. I'm perhaps being a bit melodramatic. I wouldn't be shut down. What they would say is you can only prescribe this amount, or you have to limit this, and that kind of stifles the technology. And I think it sort of stifles us doctors learning how to use it for the benefit of our patients. And I think like ultimately the benefit of all patients around the world, because I think Australians are doing better than anyone. Um, so a lot of the companies bring in innovation, and we try it out and work out how to use it. And so that's exciting, but it can also go too far. And if and people can have too much THC, and which can cause cannabis use disorder, and can people can end up in psych wards, and can it does happen. And I get the psychiatry newsletters who are highly critical of the cannabis industry, and they've got a point. And those patients are not coming from me or you; they're coming from these other clinics, which gives all of us a bad name. And
they do have a good point, but just to note, and this is was a case that
yeah,
I discussed with you and my other colleagues, was that unfortunately some of our colleagues in GP and psychiatry world, not all of them, but some of them also don't understand that CBD does
mm,
not cross the blood-brain barrier, does not cause psychosis, and
mm,
that's it's an interesting thing that I've had to feel that I've been under attack on the
mm,
basis that people are taking CBD and they think that's could be causing them to have a psychosis. I've never, it's clinically not relevant or
no,
significant. Yes,
not
THC,
CBD,
not
THC.
CBD. So I think that's something that maybe people listening, they worry about driving, they worry about, they've got all of these stigmas and myths and ideas in their head. But the reality is you can come to a good cannabis clinician and you could also use CBD on its own. And there's
Yes.
many products that allow people to still get benefit with their mood, their pain, their inflammation,
Absolutely.
whatever condition that might be. So
Mm,
yeah, I think it's a really important point that people realize that. We could talk forever as always,
mm,
Nick.
yeah. Yeah.
We are working under the same new beautiful clinic called One Health.
Yeah.
You're heading it up as the medical director, which is
Yeah.
fantastic.
Yeah. Yeah.
Congratulations, you're a
Thank-
wealth of knowledge, and I'm so happy to work alongside you and hopefully absorb more of your great wisdom.
yeah.
Is there any
Likewise.
departing
Mm.
remarks that you would like to share with the audience, or anything you think that would be important for them to know?
Um, I think if you are interested in this, yeah, I think like you said, it's finding the right doctors and clinics, and I think unless you're getting your initial consult shouldn't be less than half an hour. Sometimes they give they offer online information, or sometimes they have a nurse that calls you first to educate you. Look, I think that's okay. The nurse shouldn't be nurse prescribers can prescribe, and the nurses can educate, and I think there's a great role for that because they do some to discuss all these things. You can see how an hour can be taken up. So I'm fine with like if a well-trained nurse doing education and then speaking to a doctor about the prescribing is fine. But I think if your initial consult should be 45 minutes, 30 minutes to 45 minutes at least. Otherwise, they're not considering all aspects of your situation. And I think this sort of holistic approach, this balanced lifestyle, is key to supplementing not only cannabis, but also, I mean, just in general, right? Get enough sleep, eat good food, not too
Mm.
much stress. I mean, health. I used to work in a holistic clinic, and I remember people were doing all these fancy blood tests and testing their pregnenolone levels and their molybdenum levels, and they were buying hundreds of dollars worth of supplements, and they were so anxious and so terrified of their health and terrified of everything. I think the holistic world can go too far. Most of those patients are so terrified of everything that they developed an anxiety disorder. So I'm all about balance. Do the right thing most of the time, daily habits. Yeah. CBD dominance
Awesome.
and maybe a little bit of THC at a low dose is probably the key to most things.
Awesome.
Yep.
And are you doing any research at the moment?
No, I'm not actually. What really interests me is the role of CBD in concussion in professional sports and even amateur sports. It's a fascinating area. It ties in with my honors project that I did in neuroscience years ago now, and the breakdown of the blood-brain barrier and the inflammatory response of post-concussion, and really cannabis seems to be really, really effective for concussion and acute stages and afterwards, and even post-concussive syndromes. And so I'd really love to that side of it. And also, I'm not sure how you would study this almost the Jungian psychoanalysis of the conscious mind and subconscious, and how you would study that. I have no idea. But I'd love to. Wouldn't that
Sounds
be
like
fascinating? Mm.
sounds like you need to be learning some more psychedelic medicines, Nick. It sounds like
No,
you've
look,
started going down the rabbit hole.
I am. I guess I am interested in that. I guess at the moment, because legally it's not an option for me to be prescribing. It's sort of I've got nothing on, so I'm paying attention to the industry and the conversation, but I'm not getting too heavily involved because it's not entirely relevant to my practice. So and cannabis can be used, I think, maybe just as effectively. Who knows? We'll find out, I guess.
Yes.
So maybe in the
Yes,
future.
we will.
Mm.
Yes, well, it's
All right.
awesome talking to you, and
Yeah,
I will
you
make
too,
sure
Amy.
that the guests can find out where you are, and book in if they need to. And if you find that you start doing some studying and some researching, and you want to share any information, please do, because I love to keep up to date with everything that you're
Yeah,
up to.
yeah, will do.
Awesome. No worries. Thanks
Thanks,
so much,
Amy.
Nick.
Okay.